I'm going to bring us all together now that way. And we also have Dr. Bakshi with us as well, which thrills me, to talk for 15 minutes or so about how we can lean into those sometimes awkward, sometimes terrifying, sometimes very nervousing conversations with the people in our lives. Sarah had offered via one of her colleagues in TikTok a unique icebreaker that I had never heard before on that scale, from 1 to 10 or 0 to 10 of not letting a COVID-19 vaccine anywhere near me, to being the first person to sign up when they became available. What thoughts do the rest of you have around good ways to lean into those conversations and some of those first questions that we can ask people in our circles?
I always try to have a quote from Ted Lasso here: be curious, not judgmental. So try to not be judgmental about their reasons, and be very open and just understand why they're hesitant. And sometimes people have excellent questions and very legitimate concerns. And so just trying to address those, and just really keeping an open mind. I've got some friends that were hesitant, and they had good reasons to be hesitant, I think. And when I was able to non-judgmentally have really kind of non-threatening, non-pressurizing kind of conversations with them, I think that they were very open to it. And a number of them have gone on to get vaccinated.
I think that's a huge part of it, that like the truly terrible reasons for not getting vaccinated get a lot of bandwidth when there's actually people with like genuine questions that get buried by the volume of the people with the bad reasons. And that there are people out there that can be reasoned with, and that it is, I love using Ted Lasso as your baseline for that. I think like have your separate like side conversation going or whatever. If it's a text message chat, have a separate window in which you're like screaming into the void. It's so hard to maintain that level of like, let's talk about this, rather than just wanting to like knock their head against a wall. But that never convinced anybody, you know?
I was going to say, one of the things that I've been doing in my outpatient practice is I started to ask really in the last couple of months, and now I'm asking patients, may I ask if you've gotten your vaccine? Some of them don't want to tell me. Most of the time, if they haven't gotten it, though, they will tell me, and they'll say, well, this is the reason why, or we'll talk about it, just as Rayanne said, be non-judgmental. But one of the things that I've also done is that I have a few patients who I've known for, I have the luxury of knowing them for about 8 or 10 years now, who have autoimmune conditions, or who have conditions that they themselves were concerned about flaring up if they got the vaccine, or they were hesitant themselves, and then they went on to get it. They've actually become my vaccine ambassador. So if somebody else has a similar condition to what they have, they've given me permission to say, I'm happy to talk to that patient. I also have POTS. I also have MS. I also have, whatever the condition may be. And I'm happy to talk to them. So it takes a little bit more work. It takes a little bit more, and you need to have the right person and advocate to help you with that. But I think it's really powerful when you have somebody else who has the same condition as that person. There's a different relatability than I have as a clinician that's kind of towering over and saying, no, you should still get it.
Yeah, I think these are all, really excellent points, and we have good evidence to back up what everyone has just said. There's solid evidence that telling a story can make a difference. For example, here's my list. I'll go back to that list I had earlier. As it was already said, listen. It's so important to do that. Empathy, try to be empathetic, and there's actual evidence to back this up, that's an important approach. And I know it can be challenging because there's so much anger right now. In fact, there was a study that came out, I think, just yesterday that said that I think it was 2/3 of Canadians now are angry with the unvaccinated, and I get it. We've got to put that anger aside. It's not going to get us anywhere. It's not going to be constructive. We've really have to try to be empathetic and common ground, as was just said. Try to find some common ground with the individual that is hesitant. Maybe it's frustration with the uncertainty of the science. Maybe it's common ground because you're concerned about your family members and you're concerned about your community. Everyone has common ground. Tell your story. Why did you get the vaccine, and how did you feel about it? Almost everyone, feels awesome after they got the vaccine. And always remember to rely on the big picture science. It's so easy to get pulled into the details. Rhea was talking about this a little bit, right? The details of the science. There's all this conflicting data around boosters and, et cetera, et cetera. focus on the big picture. And there's, again, evidence to back that up. You talk about the scientific consensus, point out the rhetorical tricks that are used to push misinformation, give people a path to credible information. And I'm going to give you a path right now. This is our initiative, #ScienceUpFirst. It's a social media platform that's on Twitter, Facebook, Instagram, and TikTok. So be prepared to dance. And it's got good, credible information. There's a whole area where we give links to places that are independent and respond to a lot of the questions that we've been talking about. And the other really important thing here is we have produced shareable content. And we try to make it positive. We try to use diverse voices. We try to speak to different communities. So please come be part of the Science Up First team. We try to make all of our strategies evidence-based. So not only is the science that we're talking about, credible, but the strategies that we are using to talk to people and to have these conversations also science-based. So yeah, come join the team. And I agree with everything that has been said already.
One thing too that I think is underrated as a factor in social media, especially where these conversations are happening out in the open, is that you don't necessarily know who's reading. And like when you have some person on your Facebook or whatever that, Uncle Bill is posting his 500th meme about whatever nonsense he's on this week, you don't know who's necessarily reading. And while I don't necessarily think you need to comment on all 500 of Uncle Bill's posts, if you then have, let's say Uncle Bill's grandkids are on his Facebook page reading this, if you're the person on their social media feeds who is making yourself available in a non-judgmental way for like, you can talk to me, I'm happy to answer questions. I know there's a ton of information flying around. It's hard to know what to trust or what to believe. I've done a ton of research. I'm happy to talk to you. If you're making yourself available for that, because there's so much shame around this right now for people who aren't unvaccinated, establishing yourself as a safe person to talk to can go a really long way for them being like, okay, I'm ready to ask questions and I know who I can ask. I get a ton of these. Like I talk to people over the last 6 months that I haven't talked to in 20 years because they're like, okay, I know Sarah knows about vaccines. I can talk to her. And the bystander effect is like really significant. So even when you're having these conversations where people who haven't said a word about vaccines one way or another are reading, they get that information even if they're not the one that you're actually having the conversation with.
I just want to follow up with all these amazing points. And I think we need to talk about it. There is a bit of a stigma about discussing vaccination with people because there's this, umbrella of freedom, et cetera, that goes along with vaccination that we're all struggling with in terms of how to navigate. But I think we just have to have the conversations. And, some of my nurse colleagues have said, I'm afraid to ask people, am I allowed to ask them about vaccination? And I think we should. I think it should be an open conversation in a non-judgmental way. And if everybody who has had a positive experience is to share that so that, that's how we overcome some of the fear is to be open and honest and discuss this together. But, great ideas from everybody. I'll write them down too. Wonderful.
Yeah, Stephanie, if I could comment on that last point, I think you were so right. People often ask me what's changed in the rhetoric around misinformation, and I think you nailed it. A lot of it's become more ideological. And unfortunately, the anti-vax community has been very, very effective at injecting this idea of rights and freedom and choice. And it's private and you shouldn't be asking. My wife's a family physician and she often encounters the idea that, you do not have a right to ask me about it's sort of inappropriate to ask you about your vaccination status. That's the wrong attitude, right? And I don't think, first of all, as a law professor, I can tell you there's no legal foundation for that at all, despite what's circulating in pop culture. No legal foundation for that at all. But more importantly, I think these conversations are so important. Got to pick your battles. You got to know when it's right. You might not be the right voice. You might not be the right person. But when you are the right person, I think Sarah pointed this out, you can have such a huge impact. There's a really interesting study that just came out. And this is another good news. I love good news stories. And it said that, it's all about the message. It doesn't matter if you are, Nicki Minaj and have 20 million followers or whether you have 3 followers. The message matters, right? Right, Sarah? And if you can be that voice, you can really make a difference. And So that's really good news. And if each one of us can influence just 2 people, that expands.